GLP-1 receptor agonists are, I wouldn't say a new class of medicines. They've been around for about 10 years now, but a newer class of medicines. And they're an increasingly popular class of medicines because they're very effective at controlling A1C, lowering your sugar, which is the whole point of taking anti-diabetic medications. But not only are they very effective at lowering A1C, but they do something that most other anti-diabetic medications don't do. They help in weight loss, and they're very effective at that too. Most other anti-diabetic medications are either weight neutral, but a great many of them actually cause people to gain weight. So that's why often they're not very popular, and that's why these ones are becoming more popular, because they are, in many cases, actually more effective than older medications, but they also help in weight loss. So after you've decided to take one of these medications, these GLP-1 receptor agonists, the next question becomes, well, which one? Because there are a lot of choices out there. We're going to be talking about Bydureon and Victoza in this video, but as of right now, there's Bydureon, there's Victoza, there's Byetta, which was the first GLP-1, there is Trulicity, there's Tanzium, Sanofi just came out with one. I'm not sure if it's released yet, but it will be shortly if it hasn't been already. Novo, which is the makers of Victoza, they're coming out with a new one that is going to be a once weekly as well. So that's 7 right there, and I believe there are 2 more in clinical trials, and one of them actually I think might be a tablet. All of these currently are injectables. No one's figured out how to make it a tablet form of this. But that will be about 9 different medications that all do the same thing. They're all in the same class. And when something's in the same class, that means they do the same thing. So to give an example, let's say like a pickup truck. A pickup truck is a class of cars. What defines a pickup truck is that it's got 4 wheels, got an engine, and then it's got space in the back to hold stuff. Right? Same class. So all of these drugs are in the same class. They do the same thing. So after you've decided to take one of these, the next question becomes, well, which one? So that's what we're going to do here. We're going to do comparisons. And I'm not really going to go too much into the mechanism of action of these drugs. There are already other videos out there that explain exactly that, so I'll just leave that to them. I mean, if people really want me to talk about the mechanism of action, I'll do that, but I think, if I'm not mistaken, actually I haven't really checked, but it would be someone wouldn't be doing their job right at one of these pharmaceutical companies if there wasn't a video out there explaining exactly what it is. I've seen one before, so I'm assuming it's on YouTube. But anyways, we're going to get right down to it. This first video we're going to do is we're going to compare Bydureon, which was the first once weekly GLP-1, and Victoza, which was the first once daily. The first GLP-1, as I mentioned before, was Byetta, and that was a twice daily. Then came out Victoza, and then came Bydureon, and then a whole series of others started coming out. So we'll get to that comparison right now. What's often very difficult about comparing medicines is that often there are no head-to-head clinical studies. But in this case, we're actually very fortunate because there was a head-to-head clinical trial done of Victoza and Bydureon, and that trial was called Duration 6. And why it's called Duration 6, it's because all pharmaceutical companies like to give their trials cool-sounding names. I don't know why they do it, they just do it. So in this Duration 6, they compared directly the once-weekly Bydureon to the once-daily Victoza. It was a 26-week trial. And what they compared there were several primary endpoints. What they compared was its ability to lower A1C, its sugar-lowering ability. It also compared the weight loss gained in each different medication, and it also compared the side effects. Did one have more side effects than the other? We'll start with the most important endpoint, which is the lowering of A1C. The whole point of this clinical study was to establish, or to try to establish, the non-inferiority of Bydureon to Victoza. Because Byetta was the first GLP-1 that came out, and that was in 2005, I believe. And in 2009, I think, Victoza came out. And Victoza was a once daily, and Byetta was the twice daily. So obviously Victoza is a lot more convenient. Victoza also did a study comparing Victoza directly to Byetta, and they found that not only did it lower A1C better, but they also lost more weight. So basically Victoza was winning in every single category. It got better A1C results, patients lost more weight, and it was a once daily versus a twice daily. So that's why Victoza went off and became the market leader in this field, because it was one of the earliest ones, and it was a lot more convenient than was available at the time. So then the makers of Byetta took the same ingredient, and they tried to reformulate it to make it last longer, to make it more convenient. And that's how they came out with Bydureon. Bydureon is the same active ingredient as Byetta, but it's a once weekly instead of a twice daily, so a lot more convenient. So the whole point of this study is they wanted to compare this new once weekly version of Byetta to Victoza again and see how it stood. So in the first category, the A1C, they did the comparison, and I'll show you the chart there, and Victoza definitely did better. They both substantially lowered the A1C by 1.3 and 1.5%. So they both did a very, very good job, but Victoza definitely came out on top, so it was not proven to be non-inferior to Victoza, which basically means that Victoza was better. Maybe not by a ton, but Victoza definitely got the better results. So the next category was weight loss. And again, Victoza came out on top. You can see the charts there. It was about like 2.5 to 3.5, so quite a bit of difference there as well. The once dailies, basically the daily injections of GLP-1s, they tend to have greater weight loss than the once weeklies, because there are quite a few once weeklies out, and there are now quite a few once dailies, and that is just a trend that we see in general. The once dailies definitely do a lot better in weight loss category. And the final category was the side effects. Was there a significant difference in side effects? Did the once weekly have more or did it have less? And this is where Bydureon did a lot better than Victoza. So if you can see here, the difference mainly occurred in nausea, vomiting, and diarrhea. And you can see there that Victoza had a lot more reported side effects in this gastrointestinal sort of category. The rest of them were more or less the same, so those are not included. It is mainly in the gastrointestinal GI sort of side effects that there was a significant difference, and as you can see, there were a lot more reports of nausea, vomiting, and diarrhea in Victoza. And there were significantly more discontinuations off of Victoza because of this. So Bydureon was a lot better tolerated. You can see as time goes on that they become more or less the same. There might be a little bit more in Victoza, but it really levels out. And that is just characteristic of this class of medications. No matter which GLP-1, it does take some time to get accustomed to the drug. But after about 6 to 8 weeks, the side effects generally tend to subside away and they're not really that noticeable. But in the beginning you can see that Victoza has a lot more than Bydureon, so that's a category that Bydureon wins in. So in conclusion, what is the difference between these two? Victoza definitely comes ahead as far as pure results in lowering A1C and in lowering weight. But as far as convenience, the once weekly injection or dosage form of Bydureon might be something that someone might want to consider as opposed to the once daily injection of Victoza. And also the side effect profile, especially for someone who has never had a GLP-1 before, the Victoza might be a lot more difficult to tolerate than the Bydureon, as you can see there from the side effects. So I hope you found this helpful. I will definitely do more of these because there are a lot more drugs out there of these GLP-1 class, and there are plenty more coming out. So I'll definitely go over those. Maybe I'll even make just one big long video that just compares everything that's out so far. But I hope you found this helpful, and I'll see you next time.